My name is Cheryl Cohen, and I'm with Arthritis Consumer Experts, and I'm so happy to welcome you to Arthritis at Home on Motivation Monday. We're really looking forward to this discussion with Dr. Linda Lee. Dr. Linda Lee is, to me, the physiotherapist of all physiotherapists. She has a PhD as well and is a senior research scientist of clinical epidemiology at Arthritis Research Canada. She is a professor in the Department of Physical Therapy at the University of British Columbia. We will touch on some of the research that she's been involved in, which really relates to physical activity and the wearing of personal digital devices or wearable trackers or whatever it is the lingo of the day. So welcome, Dr. Lee.
Thank you for having me, Cheryl.
Absolutely. Listen, we want to stay with, we've had a few of your colleagues on the show already. They've talked about a couple of different things, but we really wanted to focus our discussion with you, Dr. Lee, around how people living with arthritis or other types of rheumatic disease or a musculoskeletal complaint can stay active at home. We're in the unenviable position of being in the middle of a pandemic, something I don't think we could have ever imagined in our lifetime, but here we are. And we're trying to help our viewership sort of through this time with really valuable information and tips, if you will, about what to do at home while living through this experience. So how can people like me stay active at home?
Yeah, no, Cheryl, this is a great question. I think, in the age of physical distancing, that we only allow so many hours to go outside and be active. And on top of it, I know a lot of people with arthritis may be going to gyms and swimming pools to do their regular exercise. And with those facilities being closed, it is challenging to to get motivated, and now the routine is sort of interrupted. So some of the things that we recommend people to do is to reduce some of the sedentary habits that can be easily formed when we stay at home for a long time. People have some really interesting and creative methods to stay active. Now, for example, I know some of the community groups will get together and use Zoom, which is what we're video conferencing, to continue their exercise program. I saw some of the examples. People do chair exercises together, and using video conference technology, I think it is certainly can still keep us connected, exercising together, stay active, even we're apart. In terms of not sitting too much, I think that's actually probably a bigger or more challenging topic. Now, some of my colleagues and patients and study participants, they use devices like the fitness band, smart watches, and those are really useful tools to be able to set some goals and get motivated to be active as well. And one of the things is that it can set reminders to remind people to get up and walk around a little bit. That is the whole idea. Break up the sitting is important.
So talk to us about these reminders that are on devices such as Fitbit, and how they can help keep us motivated, even at the level of motivating us to stand up regularly. I have to say myself, since I've been isolating at home because I'm at high risk, I'm immunosuppressed, I've noticed my low back pain has gotten worse. Then I realized, well, it's probably because A, I'm sitting in a different chair than I normally would to do my work, and two, I'm not getting up as much, I'm getting glued to the chair. So tell us about how these wearable devices can help us.
Right. So I think you touched on a very important topic, Cheryl. Too much sitting is definitely a big health risk. Anything from causing some of the existing muscular or bone and joint problem worse. We talk about the back pain that you have, as well as not good for your heart and lung health, general health. So the general recommendation is that people really need to get up and move around with every hour of sitting. So 2-3 minutes of getting around, even slow walking, walking from your office to the kitchen, get a glass of water, water the plants, and then come back. And do that consistently every hour when you are not sleeping. That is sort of the general recommendation. Sometimes, having a bit of a reminder, a gentle nudge to get up and move around could be helpful. So in our research, we use Fitbit. We don't use the expensive model. We use the one that everybody can afford. And even those models, nowadays, it comes with a reminder that is automatically set.
Can you show us? Can you show us?
Well, you're going to put me to shame because I've been sitting a lot. So I want you to see. Can you see that?
Yes.
Okay. And it goes away really quickly to save battery. So what you saw in the diagram is that it's a person in there, and then the dots around them. Each dot represents an hour. So there are 17 dots there. And it assumes that, if you sleep 7 hours a day, then, that you have the hours that you are awake, that you're supposed to get up and walk around. And the number, it says it's about 250 steps. So in the Fitbit, it has a setting that it will nudge you if you sit too long and you don't get up and walk around, a very gentle vibrate, mode. And so you get up and, walk around and accumulate your 250 steps. If you do that, it'll give you a hooray, a little bit of, you'd be surprised that, people addicted to, I do get addicted to those little bit of rewards. And so we know in psychology that, some of the techniques are useful in nudging people to adopt a certain behavior. And if you actually, when it's buzzing and you look at the screen, it has, sparks and confettis come out, the whole 9 yards. So those are useful behavior change techniques that, little rewards goes a long way. And I understand that many of the different other devices, smartwatch, fitness band, and they all have, certain settings and little reward systems to nudge people. So those are the sort of things that could be useful for people who stay at home and use it to remind them to get up.
Yeah, I think that's really valuable advice. So for those of you folks out there who are watching, if you have personal wearables that do track your activity and you've not tapped into this feature, maybe now is a good time to do that. Just simply getting up and moving benefits us.
Yeah, in general, moving is always better than not moving, no matter how much you move. I realized that, the general recommendation for physical activity is about 150 minutes per week. Now, if you don't do 150 minutes, it does not mean that, oh, you're doomed. And I think now the general recommendation is really that if we can facilitate and encourage and support people to move more and sit less, any amount of that is useful. Talking about, getting up, moving around every hour, that's useful. And even if you're moving slow, part of it is that when you're standing and moving slowly, you're still using large muscle.
As you say, when you're standing, we're employing our glutes, our quadriceps, our hamstring muscles, our calf muscles. We're doing exercise simply by getting up and standing. Is there some sort of practical sort of checklist, Dr. Lee, that you could recommend or at least highlight for folks watching today? I think sometimes, because we're out of our usual exercise environment, we may forget some of the things that we might be needing to do to prepare for exercise, or during exercise or following exercise. And maybe you can give us a little reminder.
Even going out for a walk, every day is a thing that we are encouraged to do, as long as we maintain our physical distance with people. It would be helpful to set a plan. Okay, so what time in the day would I like to go? How far would I like to go? What is the route that I would like to take? The having your walking shoes, your running shoes ready. So all of those things can help to keep you on track. And the more detail you set your plan, the higher the chance that you're able to achieve that goal. So I think, perhaps to start by setting a realistic goal, have it as detailed as possible. And when you finish setting that goal, think to yourself, okay, let's say on a scale of 0 to 10. 0 is I'm totally not confident in achieving that. And 10 is that I'm absolutely confident in achieving that. Honestly, ask yourself, what number would you give for this goal that you've set? Research has shown that if you have set a goal that is, with a confidence rating of 7 and above, chances are you are quite confident in achieving that. But if it's below 7, or a 2 or a 3, that would be a time to think about, like, is that too hard, too unrealistic for me to achieve that goal, and reevaluate the components of it. So that could be a good start.
Yeah, no, a plan, having a plan, setting goals, then working towards the goal, all of those things are so important messages for us to be hearing right now. I think sometimes we take them for granted and we don't really know that that's what we do every day in our lives. One thing that I have found is, I don't have some of the things that I might otherwise have in the gym to modify exercise here at home. And I'm wondering what some of the things we should be mindful of in terms of our own joint protection or safety versus how we might do something in, for example, a gym. Like the gym, there are rubber mats, your footing is very stable. I'm trying to do my exercise here in my kitchen, and my kitchen has a wood floor. So I'm finding it kind of slippy. And, I guess, how do we modify and still our exercise routine at home and still have it feel, as you say, satisfying, so that the sparklers will go off at the end of it and we get that endorphin rush that I think we all love to get following an exercise session?
I think part of it is to really have a realistic assessment of your environment. Do you actually have enough space? If you want to lay out, your yoga mat, or, to, do some balance exercise that require walking back and forth, for example. So that would be, the first thing to do, just to make sure that, some of the exercises that you perhaps learn from exercising in a group setting, that if you want to repeat that at home, you can safely do that. Having good footwear, absolutely important. And some of the, and exercising at home is no different from, in terms of the sequence of, the warm up, the, monitoring, sort of your fatigue level when you're doing, for example, your strength training. Monitoring the fatigue level, the difficulties is still important. Having the proper cool down is still important. But some of the weights, for example, that people use for their strength training, it may be different, or you may not have the same equipment to do that. So one of the things that I speak with my patients with rheumatoid arthritis, for example, is that if you are using, different set of weights or different modifications for your equipment, just make sure that you protect those hand joints. Okay, if they're hot and swollen, you really, don't want to, squeeze too hard, or if the handle is too small, you may want to find something, wrap a towel around it, or build up the size of the handle so that you can, safely do your exercise, but without hurting the joint. And finally, I think remembering what are good pain and bad pain will go a long way. So as you know, Cheryl, good pain is really when you're trying out a new exercise, a new movement, your muscle need time to learn the exercise. And sometimes a day or 2 days after that new exercise, it actually feels really sore because of the buildup of the lactic acid. Those are considered, good pain. And if you experience that, just ease off on your routine, the next 2 days. But if you do exercise, your pain increases in the joint that you're using, and that increased level does not calm down in 2 to 3 hours, probably have overdone it. So what it means is that you don't want to repeat that exercise again.
Yeah, and Dr. Bartlett talked to us about, we were talking about work, and also Dr. Bachman mentioned this about productivity and adjusting your level, your thinking around how productive you can be at home during this period. And they're suggesting that, you have to cut yourself some slack, that you're not going to be as productive, especially in a stressful time when you're thinking a lot about your health and trying to prevent contracting a virus such as COVID-19 or any other for that matter. How does that relate to exercise? How do you keep doing it but cut yourself some slack at the same time?
Well, I think the whole principle about be kind to yourself is very timely, and it works in so many different ways. When people are trying new exercises, new routines, to some degrees, you're starting something new all over again. So it takes time to make it perfect and make it your own, and cut yourself some slacks. If you're not able to, if you used to go to the pool, a swimming pool, and do the aquafit for 45 minutes, and then, you go for a walk in the evening, and now it's just not quite the same, that's okay.
Loving ourselves is so very important right now. Being kind to ourselves and to each other, I think, is pretty key to getting through all of this. Dr. Lee, we can't thank you enough for coming and sharing some pearls with us about physical activity. Thank you so much for joining us. We can't wait to see you again. And please be safe out there, Dr. Lee.
Thank you, Cheryl. It's a pleasure. Thank you.
Thanks, everyone. And don't forget to tune in for Wellness Wednesday. Bye.